also an esteemed member of the Karnataka Medical Council and the Cardiological Society of India, contributed actively to the advancement of cardiac care in India. Young clinicians and strengthening. I'd also like to mention here.
Just as building a facility, we are building a system care. India's senior population growing rapidly, but the care is largely fragmented and mostly hospital-centric. And the reality is that most elder care happens in outside hospital. That is where the gap exists. Our approach is geriatrician-led continuum care of connecting clinics, hospitals, home care and skilled nursing facility like this one. This is missing middle of the healthcare system. Just about 1 year back, we started the first facility in Alsur. The response we saw that is told us very clearly that families here looking for this kind of care. The second facility, Sarjapur, we are taking that forward. This center brings together what elders truly needed, closer to where they live. The community clinics with outpatient consultation, adult vaccination, physiotherapy and diagnosis and pharmacy. The dialysis care we created the daycare and stay care services and home care in surrounding areas with nurses and doctors available at home. Because care has to be continued, it has to be accessible and it must be a field close. Bangalore is an important city for us. Over the next 18 months, we hope to expand further facilities. And what drives us is a simple belief: elders deserve not just the treatment, but continuity of care. Not just as a long life, but better quality of life. Thank you for being here with us.
To travel here was to basically understand that what government can do for this sector by bringing some policies so that this care reaches a larger masses. Anyone who has had a wheelchair bound or bed bound senior in the family can understand the trauma they get through, helplessness what the caregivers go through. And in that regard, facilities like Geri Care, which provide not only care home, but home care. So those are very, very apt facilities. These need to be promoted, and our challenge is to find out how do we promote these facilities in a much larger way. Very frankly, the Geri Care facility at present, the costing cannot be afforded by many. So how do we bring out, the policies which make it affordable for people? It should not remain like a financial burden. And how do we bring policies that this, what we use the word care, perhaps in any healthcare, care is very critical. But I believe, or I feel that care for the elderly who are dependent on somebody's care, attendant, that is the most critical aspect, because that person who is a receiver cannot even express, because they know that they are dependent totally. So they tend to get, undergo through neglect and abuse at times. So we need to, how do we create this system which, strengthen in the society this huge growing need. All of us recognize that this huge need is there. So we at the government level, of course, there are different programs, national programs preventive aspects, especially we take care of the curative aspects. Now, this particular sector, when your preventive has failed, your curative has failed, and a person needs care, so a person needs to be brought to a care home, which I feel should be like in our social context and the way it is resource intensive. It should be like a short stay period. People coming to care home, they are brought only in acute phase, or when the family needs support at that time for a short period. That they are again integrated back into their family and the society. And this other thing, that home care, what your services provide, that needs to be really strengthened. That is really a challenge. How do you this whatever we do in our policy, we create nursing cadres. The nurses become like small doctors. They would not like to touch the patient or do anything.
Certain age, do good care heart disease, which is the most prevalent disease in the country and all over the world. And all of us who are probably consider ourselves still not geriatric, but we are going slowly towards that. And I think the care compassion which is required in any field of healthcare delivery requires more specialized kind of infrastructure and specialized training for people who provide this care. And I think as a doctor who sees of a certain standard of care given, and there are various standards of care you see all over the world. I see facilities starting very rapidly and very smartly, but the most important part for delivery of healthcare is always the quality, which we lack all over the world, all over the country. It's probably our nature that we start with a bang and then we lose our quality. The one reason for that also is there is an overwhelming need for care. We are not able to fulfill the requirement because we get overwhelmed with work. The need is so much. And I think a care like this, of course, where you have an intention to produce more and more centers where the care to, as Mr. Gupta also said, can be given to people which is commensurate with the requirement of the social aspect of that individual, which may be rural, as you said correctly, which may be urban, semi-urban localities which are not very prosperous. So I think the need would probably be varying to different kinds of people who require this care. It's not always equal. The social systems do not allow us to be very uniform, and that is the reason we're not able to provide trainings which are commensurate with the requirement of a certain